Hello everyone, welcome to this lecture today where we will be exploring Escherichia coli, also known as E. coli as you probably know it. So the basics of E. coli, basically it's a gram-negative rod, basically meaning the image right here on the right hand side, that's what it looks like. It's gram-negative, so it has a thinner layer of peptidoglycan than our gram-positive bacteria. You can learn more about this in our Clostridium difficile lecture that we posted before this. E. coli is also part of your normal flora, so this means that normally it's going to be a harmless resident there. It's going to be doing healthy or not bad things for you, good things for you, if anything. However, some strains of E. coli can be pathogenic, meaning they will cause disease. Additionally, because E. coli is all over and it's in our normal flora, meaning that it's going to be on our fingers sometimes, that sort of thing. It can spread in hospitals or nosocomial settings quite frequently. A nickname for it is hamburger disease. We're going to get into why that is quite quickly here. And it is transmitted via fecal oral routes. So through animal intestines, it can get into foods, all sorts of stuff like that, from soil, that sort of thing. So it's really important in foodstuffs like meats, milk, produce. You got to make sure that it's not contaminated or raw, because if it's raw or contaminated, it can spread E. coli. So as I was saying before, not all strains of E. coli are pathogenic. So here are some of the pathogenic strains that are going to cause disease in your GI system. The big one we have here is Shiga-like toxin-producing E. coli. So these bacteria of this strain are going to create this toxin that's going to damage the interior of your intestines. We have some other strains here listed underneath, UTIs, etc. We're not going to be focusing on these, but basically they're similar to the STEC bacteria, except they're not like the 0157H3 strain or serotype. And there's some special properties about the 0157H7 strain that we're going to be looking at, because it's one of the most pathogenic strains and it causes some quite severe outcomes, more than just the common ones you'll see in a GI infection. The Shiga toxin producing E. coli also are sometimes called enterohemorrhagic E. coli. That just basically means, by your Latin roots there, that it's causing bleeding in like the insides of your colons, basically insides of your intestines, because it's going to be damaging them with the toxin it's producing. These STEC strains are going to be the most clinically significant, and we're also going to be focusing on them for this lecture. In cases like where it's getting into wounds and stuff, many of the non-pathogenic or normal flora E. coli, if they get into there, they can cause a lot more damage, or even urinary tract infections, because those environments are usually sterile or almost sterile. So if any bacteria get in there, even if they're usually healthy in your gut is built to sustain those bacteria. And sometimes places like your kidneys or wounds inside of your skin and stuff, they're not built to have any bacteria, so any bacteria in there will cause infection. Okay, here you see some biofilms of E. coli building up. Biofilms are basically just little colonies of bacteria. They grow together. They regulate as one metabolizing unit. They're harder to get rid of than just free-floating bacteria, and it's something that we're going to explore in further lectures. So now into some risk factors. So as I said before, E. coli can get everywhere in the environment, especially when you think about animals and it being in their intestines. Big thing here is uncooked meat. That's why it's called hamburger disease. In the United States, for example, there's been several fast food outbreaks. So you might have this lovely looking burger down here. If it's not properly cooked or not fully cooked for whatever reason, if there was any E. coli contamination in the butchering process or anything like that, you could have a nasty surprise waiting in that burger. Yeah. As well, there's been some outbreaks with apple juice. If it's unpasteurized or contaminated somehow, it can basically be spreading in tons of environments. There's been times where it's contaminated drinking water, all sorts of foods, milk, like I said earlier. So it's really important that these things are cooked properly and handled correctly. Also, petting zoos, you can imagine, because you're touching all those animals and they're probably not being the most hygienic compared to us. You can imagine that some E. coli could get on their fur or whatever. So yeah, there's a lot of places you can be getting E. coli. You're probably you're probably exposed to it a lot more than you'll notice, because unless you get the pathogenic strains, you're not going to really notice that, oh, I've just picked up some E. coli. Okay, so talking about prevention, things that I mentioned before, you got to make sure that things are properly cooked and you're being hygienic. So for produce, you got to wash it really well. Meat, you want to cook it all the way, um, especially for things like ground beef. Steak, if it's a little medium rare in the center, you're probably okay since it's not being contaminated by anything. Like there's no knife touching it or whatever. Um, Produce as well, you want to wash that. And if you're cooking it for whatever, if you're not washing it, you want to probably cook it thoroughly. And then just general hygiene, thinking about if you go back to the petting zoo, you want to wash your hands properly, sanitize, and that sort of thing. And stuff in the kitchen, you don't want to contaminate raw and cooked. So when we are going to get pathogenic strains here, they're usually going to cause something called gastroenteritis. And gastroenteritis is basically the inflammation of the stomach and the intestinal mucosa. So those layers that are on the outside of the inner lining of those organs, the part that your food is going to touch as it goes down your digestive system, those parts are all going to get inflamed. And this is caused by the toxins that the pathogenic strains are going to produce. When it produces these toxins, they're going to damage the cells in the mucosa, and when that happens, you're going to get an inflammatory response. As well, very commonly, you're going to get diarrhea. Diarrhea can have a lot of other problems. Biggest and most important probably is dehydration, because you're going to get massive fluid loss if you're not keeping up your water intake at the same time, and if it continues for any significant amount of time. So you're probably going to get abdominal cramps, some pain from the toxin, you're going to get some nausea, maybe some vomiting, that sort of thing. So basically, you're like stomach flu, food poisoning like symptoms. That's a good way to think of gastroenteritis. And one of the big complications what we just looked, gastroenteritis is basically a nice mild case of food poisoning, a mild case of a pathogenic strain of E. coli. However, not all cases are going to result in a nice little case of food poisoning. Things might get quite serious if you have a bad strain. One of these strains is the O157H7 strain that I mentioned earlier. If you get that strain of a enterohemorrhagic E. coli, you might get this condition, and this is hemolytic uremic syndrome. Basically, what's going to happen here is the toxin that the bacteria is producing, that specific serotype, if it produces this toxin, and this toxin gets into the bloodstream and into the blood vessels, it can cause damage to the outside of those blood vessels. And what's going to happen is that your clotting factors and your clotting proteins are going to attach to those sites. And when they adhere to those sites, you can think of it as them kind of like, they're going to stick out into the vessel. And while they're sticking out into the vessel, they're going to snag some blood cells that are floating around in there. So you're going to damage some RBCs, red blood cells, and those blood cells are going to rupture, be destroyed. So that's going to cause some serious issues. You need those red blood cells circulating around you, delivering oxygen. You're going to develop some anemia, and you're also going to be running out of platelets and your clotting factors if this high rate of clotting is sustained, because you're going to have all this damage in your blood vessels that your blood clotting factors and proteins are going to want to adhere to and stick to. So to diagnose this, you're going to want to look for kind of two main things. You're going to want to look for the changes in the blood cells and their concentration. So you would expect lower rates of red blood cells, lower rates of platelets, also things like lower hemoglobin because it's being destroyed. You'd also expect elevated creatinine. You're going to expect your kidney function to start lowering and to be damaged, because one of the places that this is going to most affect is your kidneys. So your kidney is going to have a lot of this blood vessel damage going on right now, or going on when you have this syndrome. And that's going to lead to some kidney injury and maybe some kidney failure. So if your kidney's not functioning, you're not getting all these toxins out of your blood, and that is a really big issue if that's sustained for any significant amount of time. So what we're going to need to do is have this patient on hemodialysis to replace the kidney basically for whatever time it needs to heal. Hopefully it heals. If it's not treated, it will be fatal, because these toxins are going to build up in your blood, and if your kidney can't get rid of them, that's going to cause some really bad buildups of toxins in your blood that are eventually going to lead to death, basically. So in this case, you want to be focusing on hemodialysis and supportive care for this syndrome. So of course, E. coli, as I said, infects a lot more than just your GI tract, even though we're focusing on it this lecture. UTIs, it is the most common bacteria to cause a UTI in anybody, so it's really important there. As well, it can cause sepsis, pneumonia, wound infections, because it's just everywhere. It can kind of get into anywhere, really, any part of your body, and if there's an opportunity, it will probably take it. We will be focusing on some of these topics like sepsis or pneumonia or wound infection in another lecture. I want to keep this one kind of in a digestible size. So for diagnosis of E. coli and its pathogenic strains, there's a couple things we could do. We could sample and culture infected tissues, blood, urine, that sort of thing, depending on where the infection is, of course, stools, that sort of thing. You could culture it and check for, you could grow it on an agar plate, basically. That's what we have down here on the bottom left. The lab will find out some stuff about it and can basically figure out what type of bacteria you're dealing with. As well, we can be performing a Shiga toxin test, and it's basically going to figure out if you have Shiga toxin or Shiga-like toxin in your stool, and that's going to indicate that there's some of this pathogenic Shiga toxin producing bacteria in your GI system. And if that's there, it's probably causing disease. So a positive test. However, there is some other strains of bacteria that aren't E. coli that do produce Shiga toxins. So it might not be specific to E. coli that you're going to get a positive test result. It might be a different type of bacteria, but regardless, it's going to tell you if there's a Shiga toxin being produced in your gut. These are really the only specific things you can use to diagnose E. coli infections. You could do off the symptoms and stuff, but there's plenty of other microorganisms. Even just looking at the Shiga toxin test, there's plenty of other microorganisms that cause the Shiga toxin or produce it. So yeah, based on the symptoms, you can get an idea that it could be E. coli, but you're not going to be able to rule out the other causes of gastroenteritis, that sort of thing. So really, the only way to specifically identify that it's E. coli, if you wanted to change your antibiotic treatment, so something very specific for E. coli, sampling, culturing, that sort of thing is basically your best way to get a specific diagnosis of an E. coli infection. Now to the treatment of most GI infections. And for most GI infections, we're going to focus on antibiotics and loperamide. Antibiotics are going to get rid of the bacteria. and the pyramide usually helps with the diarrhea and symptoms. However, we're not going to use these treatments for the 0157H7 strain or serotype. This can actually make outcomes worse if we do antibiotics and that sort of thing, and it can increase the risk of HUS. So we want to be only using supportive care for these patients, making sure they're hydrated with IV saline and that sort of thing. Antibiotic that you can use commonly that will work well is ciprofloxacin. For non-GI infections, we're not going to go over everything, but because that would involve a lot of detail. Basically, we just want to be using antibiotics if it's anything serious. Mind you that even for the GI infections, you don't need to be using it if it's just minor symptoms. You really want to be using antibiotics if it's somebody who's actually getting sick or consistently dehydrated with it, or might have a compromised immune system that otherwise this infection might get more serious in them. Because again, we don't want to be overusing antibiotics. That could come with a lot of other risk factors, like we talked about in our Clostridium difficile lecture. Antibiotics really won't change the outcome of the patient if it's just diarrhea. It's only going to affect it if there's some serious complications that are possible or happening. So for UTI sepsis, we want to be using antibiotics. Same thing for pneumonia, except with the addition of respiratory support. And then across the board, just making sure we have adequate supportive care if it's a serious infection. So E. coli has a lot of other uses. It's a model organism, so it's used a lot in research for people studying bacteria, genetics, because it will mutate so fast. It's also used to manufacture proteins. So things like insulin and clotting factors. We used to get insulin from things like pigs and stuff. So you'd have to use animal proteins to give ourselves insulin. Now we just can get these E. coli to produce in little petri dishes, that sort of thing. And that is wonderful. We just insert the genes into them, and then they'll produce these proteins that we need. It's really helpful. So a summary quickly here. To wrap things up, E. coli is a common and normally harmless bacterium, but some strains produce toxins that are pathogenic. These are disease-causing strains. Fecal oral exposure to the bacterium can cause infection, especially in relation to foodstuff, remembering that the nickname of this disease is hamburger disease. It can be in all these different places, all over produce, that sort of thing, soil, so we got to be careful of that, making sure we're properly handling foodstuff. We want to remember the serotype 0157H7. We want to remember the special things about treatment and not using antibiotics and loperamide, and that it can cause HUS, hemolytic uremic syndrome. So we want to be watching out for that and remembering what that disease presentation is going to look like if it gets to that severe stage. We want to remember that treatment may include antibiotics and loperamide in some situations, remembering when and when not to use that. And finally, E. coli is used in research and industry, and it can produce proteins like insulin or the clotting factors. That is all for this lecture. Here are some sources and some areas you can find more info if you're interested. Thank you for watching this lecture. I hope you enjoyed it. Make sure to subscribe and like, and hopefully we'll be able to get more of these videos out soon. Goodbye.